because it is very important that every patient gets up and walk. If a patient is already ambulatory on their own, you want to make sure that you're getting those patients that aren't as ambulatory up and walking first, because those are going to be the ones that are higher risk to develop a DVT. The next goal I want you seniors to remember is that the family members are also very important in this situation as well. A lot of the families are at the bedside and they need to know what they can do to help. So you need to know that you need to teach the family as well as the patient about DVTs and the importance of ambulating, about sub-Q injections of heparin, and the importance of moving around. So some objectives that I want y'all to learn also while y'all are in this course is that you're going to have a quiz, and you're going to take it the first day of class before I teach you anything, because I want to know what your knowledge is about DVTs. Excuse me. So you're going to have a quiz that you need to make an 85% or higher on, and it's going to be a quiz on what to know about DVTs. And then you're going to take the quiz before, and then you're going to take it on the very last day. And that way we can determine what you learned throughout the course and determine whether or not this course was effective or not. The next objective is you're going to go out and teach back this information to lower level students in this nursing program. And this way you're going to actually learn what you're being taught. And this is a good way for you to learn, because not only are you having to teach it back, you're learning what you're taught. In order for you to be able to go into the hospital setting, you'll have to take your quiz, you'll have to be able to do teach back, but then you'll be able to, you'll have to ambulate 3 patients by the end of the semester, helping prevent DVTs. The next objective is you will be able to administer sub-Q heparin by 2 o'clock in 3 patients properly with the preceptor by the end of the semester to prevent DVTs. And the last objective that I have for you seniors is that you'll be able to properly demonstrate and set up the PCDs on a patient by the end of the shift to prevent DVTs on patients. Because, just walking around giving sub-Q heparin is not enough sometimes. Sometimes we need everything that we can to help these patients to prevent a DVT, because the last thing we want is a patient to be in the hospital longer just because they got a DVT. So again, like I said, some task and evidence that we're going to do is you're going to have to properly pass the what to know quiz. You have to pass it before you're able to go into clinicals, and you're going to have to pass it to be able to finish the course out. You're going to have to demonstrate how to properly ambulate patients. Some people think, oh, that's easy, you just have to get up and walk them, but it's not. Some of these patients have difficulties, they have lots of lines and drains, so you have to know how to assess and get them up and walk. Students will demonstrate how to properly administer sub-Q heparin. That's something that we will have to check you off before you even go into the hospital setting. There will be weekly worksheets and online modules. This class is primarily an in-person and clinicals. There's going to be no books needed. It's going to be taught using PowerPoints, modules, and online modules. And like I said earlier, some quizzes. So the computers that will be used will be the computers in the hospital setting and in the computer lab. So the timeline for this course is going to be a 3 to 4 week class. The quiz that will begin the first week to assess the students, just to assess what the students know about DVTs, and then the final week to see what you have learned. It has about 4 or 5 questions on it, and you have to have an 85% or higher to achieve this before you learn to move on to continue on. So that's week 1. Week 2, you're going to learn about the medications that come with DVTs, because there are a few. You can have sub-Q meds, you can have oral meds, and you can have IV medication. So you'll learn all about that in week 2. Week 3, you'll just get a little bit about what to know about DVTs, and then week 4, you'll have the post quiz to see what all you have learned. And then So DVTs are becoming more of an issue in the hospital because patients are coming in for surgeries and traumas, and afterwards they don't want to get up and ambulate and then they get stuck. Or they don't want to get stuck with anticoagulation medications. So patients need this education to help get them moving so they can prevent a DVT. So this is where it's really important that y'all understand the importance of why a patient is getting these anticoagulation medications, because just because you don't understand isn't going to help when you do your education. So this is the time that you really understand why these medications and this ambulation is important, so that you can stress the importance to your patients so that they know. Because DVTs can be preventable when the patients are ambulatory and they're getting their sub-Q heparin. So we just have to remember that and relay it onto the patients. So I plan to teach this class with hands-on learning as well as computer modules. With hands-on learning, I will teach the students, or you guys, with proper education. So in the hospital, so we'll start off with mannequins, and that's how you're going to do your sub-Q heparin. And you're going to have to do that before you go in the hospital, and then we'll have our quiz. And then we'll talk about medications, and you have to know and tell me about the medications before you can give the medications to the patients. So it's very important that if a patient refuses a sub-Q heparin, that we talk about this and what you're going to do if you have a patient that's irate and that you can't convince them to take this, and it's a patient that really needs this anticoagulation. So we'll talk about the difficult patients and what we need to do, and how to go from there. And then we wrap everything up and talk about the post-quiz and any other questions that y'all might have, because that wraps up the week 4 of DVTs. Like I said, DVTs are preventable, and that's our goal, is to prevent DVTs in the hospital setting. It's the last thing we want is a patient to get a DVT. So if we can prevent it, then that's what we need to do. So then after that, there is a 4-question post-quiz that you need to make an 85% or higher. And if you do that, then you're able to go into the hospital setting as long as you've passed the quiz, done your teach back with the lower level students, and you've passed your medication demonstration. And that is all. If you have any questions, students, just let me know, and I'm here for any further questioning.